How to quit smoking? We all know that smoking is injurious to health. It is even written in the cigarette packets. But still we find it difficult to quit. It is often ingrained as a daily ritual to have it while sipping your morning coffee, or as a feel-good break from office stress. This is because smoking is not just a physical addiction, it is a psychological habit as well. These habits, addiction and daily routine, should be addressed at the same time to successfully cease smoking. But remember, you need the right support and quit plan to pursue the same. Here are some of the tips. Distract yourself when you have cravings by doing household chores, playing a game or calling a friend. Remind yourself about the importance to quit smoking, as it increases your self-esteem, saves money and protects your health by lowering risk of several lifestyle diseases and now presently, COVID-19 as well. Keep your hands busy, as it is a good substitute for tactile stimulation. It can be pressing a stress ball. Keep an oral substitute when craving hits like mint, carrot, celery sticks. Keep your mind busy by reading a book you love or playing your favorite music, or even solving a Sudoku. Avoid common triggers, like alcohol and other smokers, when you are in quit plan. Try including simple breathing exercises and increased physical activity in your daily routine. Do not forget that in the quit plan, you might have nicotine withdrawal symptoms. These symptoms include irritability, anger, restlessness, increased appetite, increased coughing, constipation, depression, headache, insomnia, and decreased heart rate. The experience might be unpleasant, but it is temporary. Your body will get back to its normal state once the toxin is completely flushed out of your body. Nicotine replacement therapy. As the name suggests, this therapy aids in reducing the nicotine withdrawal symptoms. This therapy shows an increase in smoking quitting cases from 50% to 70%. But this is not a coping strategy. This therapy deals with the physical addiction to nicotine but plays no part in the psychological aspect. It is recommended that do not pursue this therapy by yourself, and get the advice of your physician, since you might be allergic to some of the substances. Nicotine gets absorbed by skin, mouth and airways. This is exploited in this therapy. The elements used in the therapy includes nicotine patch. This is the most convenient form of nicotine, and has proven long-term relief from nicotine withdrawal. Nicotine lozenges and chewing gums. These are absorbed by the inner surface of the mouth, then by the inner lining of the intestine. Since food and drinks affect the amount of nicotine absorbed, it is advised not to have or drink anything 15 minutes prior to intake of gums or lozenges. Nicotine lozenges are easier to use than the nicotine gums. Do not bite or chew the lozenges. It is advised that you should suck the lozenges for 20 to 30 minutes until it is completely dissolved. If chewing a nicotine gum, chew it until you get a tingle in the mouth or a peppery taste. And then park it inside your cheek till the taste fades away. Then repeat this cycle again of chewing it till the tingle feeling and park it back. Nicotine nasal sprays and inhalers. This is the most effective nicotine replacement therapy, but it requires doctor's prescription. This is because the inhalers or sprays are so fast-acting that it can make a person even more addicted to nicotine. Smoking cessation medicines. There are some prescription drugs that aid in quitting the addiction. But if you opt to use it, a doctor's advice and prescription is needed. Bupropion is a prescribed medicine that treats major depressive disorders, and also supports smoking cessation. This drug acts on the chemicals of the brain that promotes nicotine craving. A dosage of 150 mg per day is usually prescribed, and the continuation of the dosage is decided by your physician. Common side effects of the medication involve headache, dry mouth, insomnia, indigestion and irritability. Varenicline is also prescribed for smoking cessation. This medication reduces the craving, and also decreases the pleasurable effects of cigarettes and other tobacco products. This medicine is a partial nicotine antagonist that gives you a mild sensation, as if you are smoking, but at the same time it blocks the receptors from giving the full effect of smoking, which reduces the pleasure you get from smoking, as well as nicotine withdrawal. But the biggest side effect of this drug is that it increases the risk of depression and thoughts of suicide.